is the real footage of what happened in trauma unit. Pretty chaotic, isn't it?
Trauma unit is the most hectic and challenging unit. Every hour, they will receive new cases. In one of the common cases they receive is patients suffering from cardiovascular disease. According to WHO or World Health Organization, cardiovascular disease is the #1 cause of death globally, taking an estimate of 17.9 million lives each year.
Cardiovascular disease is a group of disorder of heart and blood vessel which include coronary heart disease, rheumatic heart disease, cerebrovascular disease, and other conditions. Cardiovascular disease is very common nowadays, especially heart attack and coronary disease. But have you ever heard of cardiac arrhythmia?
Cardiac arrhythmia are accelerated, slow, or irregular heart rate caused by abnormalities in the electrical impulses of the myocardium. There are 4 types of arrhythmia, which include bradyarrhythmia, tachyarrhythmia, supraventricular, and ventricular.
Now, let's talk about common arrhythmia cases.
Bradyarrhythmia is a slow heartbeat. In adults, this is considered less than 60 beats per minute. Tachyarrhythmia is an accelerated heartbeat which is more than 60 beats per minute. Ventricular arrhythmia is an irregular contraction of the heart's lower chamber. It can be life-threatening and requires immediate medical care. Lastly, supraventricular arrhythmia, which is an irregular contraction of the heart's upper chamber. The common supraventricular cases is atrial fibrillation. The exact cause of cardiomyopathy is still unknown. However, they assume it is caused by blocked arteries in heart, high blood pressure, drug abuse, and certain supplement and medication intake. As a precaution, you need to know the symptom of arrhythmia. So what are the symptoms of arrhythmia? The patient will experience rapid pounding heart, panting, fatigue, chest pressure, and shortness of breath.
So, how do we treat cardiac arrhythmia? Modern problem requires modern solution. In most cases, a pacemaker will be installed in a patient's heart.
So, what is artificial cardiac pacemaker and who were the inventors? Artificial cardiac pacemaker is known as a small medical device that plays a role to specialize in regulate or reproduce the rhythm of the heart by using the electric impulses. The artificial cardiac pacemaker was created by a Canadian electrical engineer who was named as John Alexander Hoops. This discovery had begun when Hoops was assigned to Bantam Institute in 1949 to have a research of the use hypothermia to slow the heart rate and permit open surgery by a cardiac surgeon named Dr. Bigelow and his research assistant named John Callahan. While John Hoops was researching the effects of radio frequency heating on hypothermia, he accidentally got an idea to invent a device that able to regulate the rhythm of the heart when the heart stops beating as the temperature drops by using electronic stimulation. Finally, in 1949, Hoops' idea has led in the creation of the first artificial cardiac pacemaker that able to reduce the risk of complications before and after surgery for a patient that was kept in a state of hypothermia. However, this device was the size of a small cathode ray tube television in which the patient had no choice but to carry it around like a luggage. Few years later, Dr. Rune Elmqvist, who was a Swedish engineer and also a cardiologist, had been created the first implantable artificial cardiac pacemaker, which is smaller than the previous device and easy to bring anywhere. Unfortunately, due to the lack of the time, his first device can only last within few hours and needed to be replaced with the new artificial cardiac pacemaker after it stopped functioning. Not long after that, an American electrical engineer named Wilson Craig Batch was accidentally created the most systematic and long-lasting device after he mistakenly inserting an incorrect component that produced the electronic pulses by the device instead of recording the heartbeat sounds as he planned. He then realized that the device could have an irregular heart kick pace by supplying shocks that will help the heart muscles to pump blood, in which this made him awarded a patent of the device and being called as inventor to the first implantable pacemaker in 1962. Now, the great batch invention of implantable pacemaker has been extended and been used until now.
Aren't you curious on how does pacemaker work? There are many types of configurations of defibrillator: single chamber pacemaker, dual chamber pacemaker, biventricular pacemaker, and implantable cardioverter defibrillator. This pacemaker will be installed according to the types of heart problem experienced by the patient, means that different pacemaker treat different types of arrhythmia. If every conduction in the heart is normal and the issue is with sinoatrial node, single-chamber pacemaker lead will be installed to the right atrium. Thus, that will stimulate the depolarization in the right atrium, and this electrical activity will pass it to the left atrium through the AV node to the ventricle, and normal contraction of the heart is stimulated. However, if the problem is with the AV conduction, they will place the lead of the pacemaker in the right ventricle, which will bypasses the atrium and stimulate the ventricular contraction directly. Dual chamber pacemaker. This pacemaker's lead will be placed in both right atrium and ventricle. The contraction of the atria and the ventricles are synchronized by the pacemaker. Biventricular pacemaker will have its lead in three parts of the heart, which are in right atrium, right ventricle, and left ventricle. This will be used in the patients that suffer from a severe heart failure. Its objective is to synchronize all of the chamber to try and optimize the heart function. It is also known as cardiac resynchronized therapy. The function of implantable cardioverter defibrillators is to continually monitor the heart and apply defibrillator shock to cardiovert the patient back into sinus rhythm. If they identify the patient develop a shockable arrhythmia.
When a patient wears an artificial pacemaker, there are some precaution steps that they need to know in order to avoid future problems. First, avoid placing a turn-on phone next to the pacemaker implant. This is because our cell phone emits the electromagnetic wave in which it can interfere the pacemaker from stimulating pulses in order to reproduce the rhythm of the heart. If the patient with pacemaker need to make a call, they have to hold it to the opposite side of where the pacemaker was implanted, and at least hold it or put the cell phone 6 inches away from the pacemaker. Next, be alert with the security system. For an example, if the patient passing through an airport, the metal detector will not interfere with pacemaker. However, the metal inside it may sound the alarm. Therefore, the patient should avoid standing or leaning on the metal detector unit and always keep an identity card stating that they have pacemaker with them in order to avoid future complications. Lastly, if the patient wants to meet a doctor, he or she need to tell their doctor that they have a pacemaker with them. This is because some of medical procedures, especially the one that needs to use electromagnetic spectrum, such as CT scan and cancer radiation treatment, could interfere the pacemaker from delivering the pulses to the heart and ignore the rhythm of the heart. So, that's all that you need to know. Bye!